Hello there, everyone, and welcome. So here we are with another video. We're going to do social worker tips part 3. I hope you guys all had a wonderful day so far. Okay, so let's get started. Okay, so we have here child parent caretakers. Okay, so we have here relationships between the child's parents or parent figures. So you want to be very observant when you are visiting the families. You want to observe what's going on between each child and the parent or whoever the parent figure is. Sometimes it could be a step parent, it could be a grandmother, grandfather. It could be a temporary person in place, maybe from the court sometimes. Okay, so we want to watch to see what kind of interaction is going on between the child and that caretaker. It's very important to note, because if you see any stresses going on in your observation, you're going to want to explore that and see what's going on there. Okay, and I have positive and negative. This is very important. You want to make sure that if there whatever positives, maybe there are no negatives that you're seeing at the moment, whatever they are, if they're positive or negative, whichever way, either one or the other or both, you want to write this down. Never mind about just being observant. You want to make sure it gets into your progress notes. Very important, because you do not want that to come and bite you somewhere in maybe a court case or a particular meeting where you say this, and that about whatever was going on. And then, they're looking for discovery. They're looking through notes about when did you hear this, and then it's not there. That's a problem. So it's not evidence. It's not even a hearsay. It's nothing. It's nothingness. Okay, you want to make sure that you're recording all this. You want to write it down. Then I have here does or does not feel secure or comfort or receiving guidance at home. Okay, these are very important areas, when you talk to the child. You'd be surprised how many children will just sit there with a big smile on their face because they're scared to tell the truth. So, that's where, the part comes in where you're interviewing each person in the family separately. And sometimes it does not work to do that in the house, because I always say that the walls have ears. So sometimes you might want to have that second visit, like even though you are um, interviewing in the home and the parents and everyone else is seeing that each one is being interviewed, you also want to try and do, if you suspect something, you want to do a second interview and have that child in the office so that you have a separate room where no one else can hear that child talk. And then you have to keep that confidential somehow, and to see where you're going to go with that. Okay, and that's a discussion that comes up between you, your supervisor, and your managers. Okay, what else do we have here? Receiving guidance at home, are they comfortable? You get to see that. And if things are not really going so great for the child in some aspect, that's where your observation might start to find out that the child is not receiving any guidance in somewhere, somehow. Sometimes children in homes just exist and the parents are like on another wavelength. Those are the things you're looking out for, because then what kind of family atmosphere is that, you know? Okay. These are things you want to look for. All right, let's go to the next slide. Children and health. Okay, medical status. Any chronic health issues you're discussing, right? And the use of medical forms. There are medical forms. I don't know if they added any more to it, but I remember there were forms for asthma and allergies. You know, it's very important to have parents fill that out, or if, you know, you need to get letters from doctors, it's all very important. You do not want to forget that. You need to ask those questions. There's nothing worse than a caseworker who does not ask that question, does not have these forms filled out, and oh my, if there ever comes a point in time that maybe the child passes away for some reason, and there is no form on record that points to this. Because you see, if it is written, you know, and confirmed, right, from the doctor, and if you're monitoring, you're checking to find, the doctor is saying that everything is up to date, you're checking in with the doctor says everything is fine, the parent keeps up to date appointments. Okay, so that you have done your part, because if that moment in time comes where, God forbid, that child passes away or something. And I've seen cases like that. Not my cases, but I heard of cases like that. Not my cases. I never had a case like that. It's the most awful feeling in the whole world. I've seen, you know, caseworkers just like totally collapse around that, because they just can't even believe that that happened in their case. But it wasn't the caseworker's fault. I don't know how it went, but I know that there was such, and you want to make sure that you have done everything. You did your P's and Q's. You dotted all the I's. You checked everything. You made sure that you did your part 100%. Okay, because it's very important to cover yourself. Okay, then we have here HIPPAs signed. Whenever you go into the you're meeting that family for the first time, you have to have HIPAA signed for every child, and also for the adults. In some instances, yeah, you want to make sure that if they're having any kind of medical issues, that you are checking up on that as well. Not in a general status. I mean, like if they really have some kind of diagnosis, you know, that may cause them not to function to take care of their family. I mean, that's a medical that you want in your file. Then I have here, let's see, insurances, services, if any, because you never know. You might meet a family that already has some kind of services in place. You want to know that they have insurance. You want to write it down. Okay, that's important. And if they don't have insurance, that's something that you're going to work on. That's a definite. Okay, let's see. Dental. You want to make sure that you're getting dentals on these children. I mean, you know, it's not applicable if you're talking about an infant, but you know, the age group that, you know, children go to see a dentist, you want to make sure that you're getting letters in your file that they have up-to-date dentals, right? All part of it, all part of health. Okay. Okay, let's see what we have here. Let's go to the next slide. Education. Okay, we have report cards, school meetings, and educational services. It's very important when you get your case that you want to visit the school. You want to make sure that you have their information, fax numbers. You want them to have your information so that they can contact you if there's a problem. You want to have that school meeting so that you could try to get, at that moment in time, whatever records you can about the child's education. At this point in time, you might be finding out if there is any difficulties going on, or maybe there are services in place. You want to know what those are and what those meetings are about. Maybe they can invite you to those particular meetings. Okay, it's very important. Evaluations. Sometimes, if you're finding out about difficulties with their education, you might want to recommend an evaluation, or maybe the school might be having this conversation with you. Vice versa, they might actually be having this discussion with you, saying that we spoke to the parents and, you know, like they're not giving us a positive response. They're not responding at all. You don't know what you're going to hear. And at that point, you need to document that. You need to have a conversation with this parent because, I mean, who would know best? The teacher is seeing whatever's going on every day and what possible difficulties are going on there with the education. We want to find out what those are, right? Okay. And then we go on here to problems like truancy, behavioral suspensions. You know, we want to check into that. Then we want to find out the whys. Why do they have these issues? Okay, that's very important. Sometimes you'll find out that the behavior issue is really not a behavior issue. They may not be understanding. It could be a language barrier. I remember a case like that. I do remember a case like that. And it turned out that, and there was several different cases. I remember language barrier. I remember there was a case that there was autism, an autism level, but the school perceived it as the child had a bad behavior. Okay, so these are the things you want to be very careful and watch, be observant, have more conversations with the family and the child, because maybe you might be putting in a recommendation for the evaluations with your supervisor and managers. That's important. You don't want the child to have on their record as labeled, like bad behavior. In the meantime, they might have, they need services to help them with whatever their level of needs are. Then I have NA, not applicable. Well, you're certainly not going to be talking about education for an infant or if they're not of school age, correct? So there you go with that. That goes without saying, right? Okay, let's go to the next slide. Okay, we have developmental. Okay, so we have milestones. At every age group, there's when we mean milestones, is developmental activities. They're raising their hands, following you with their eyes, all different age groups for different developmental levels, progressing. When you first walk, when you first talk, if you could even stand up, or if you're hearing, can you hear? There's so many things that you could find out when you're checking milestones. And you want to write that down in your notes. Okay, we have exceeds, does not meet, or meet. Okay, so that's important in the way of if a child doesn't reach a particular milestone by their age group, then you want to work on getting an evaluation and services in place because you don't want the child to fall behind, because then that's when our delays, or maybe we're going to find out about disabilities, which we're going to talk about next. You see delays and disabilities there. That could be something that comes up next. So if we don't know this by now, and you just think, oh, well, the child is being quiet and not talking right now because they're going to be a late talk or whatever. And sometimes you might find that child is not going to talk even to maybe 3 years old or 4 years old because there's something going on and we don't know what it is. All right, so we want to be very observant in this area and be ready for evaluations or services. Okay. All right, and that was the last bullet point there, the services, because you might get to this point where you're going to recommend services and you're going to have a meeting about it. All right, so that's developmental. Let's go to the next slide. Children and interpersonal skills, relationship skills, social skills. That's something that you want to be observing. You're asking questions, even when you're in school. Those are nice questions to ask because you can find out right there, because you may not be able to see it all in the home. Let's say there's only one child in the home, but you're not seeing too much because the child is playing with their toys, or maybe or if they're older child, maybe they're talking on the phone, or they're watching TV or playing games, and you're not even having too much conversation. So you don't know. So your school, if they're school age, daycare is a good place to be checking this out, to find out, and even asking any family members that you are interviewing. That's very important because from our young age, we want to be able to communicate and be able to use social skills. I mean, you need to be able to communicate in a group of people or in school, if you're in a store, anything in life. It's right. We're talking about communication skills. And that covers relationships, social, friendship development. Does the child have friends? Sometimes children are very shy and they don't develop any of the above. Then we're going to find out what we could do about that. Okay? Then that's a discussion. You want to see what you could do to help in this area, the difficulties and services I have there at the bottom. Okay, these are subjects that you'll be talking about with the parents, and you could talk with your supervisor and manager and see if there's something that we can do. We have all kinds of services. We even have activities. Maybe the child needs to be engaged in activities, but maybe the parent can't afford it. There's all kinds of things that you could work out in this area to give that child some skills to work with. There's a lot of programs out there. Agencies have these under their belt, and it would make for a good discussion with your team. All right. Okay, next. High risk. So we have behavioral high risk and history here. So behavioral high risk could be a child that engages with maybe prostitution, selling drugs, theft, getting involved with gangs. There's all kinds of different behavioral risks, and that you need to ask questions like that will kind of wrap around that. Like, let's say you're finding out from the parent that the teenager doesn't come home till 11 p.m. at night and she doesn't know where the child is, or that she doesn't come home till 3 o'clock in the morning, or sometimes she doesn't come home for 2 or 3 days, or disappears for the whole weekend. So these are the things you want to find out because you don't know what's going on there. All right. And then you want to check if there's any history about it, because it could be a record somewhere in time that could help you with that observation. Okay, engages in high-risk activity and services, and then we have engages in high-risk activity with no services, because sometimes there could be services in place, but we're still seeing the activity. Or vice versa, we have engaging in the risk and there's no services, and maybe you have to put services in place. Maybe there's got to be a special kind of monitoring, something extra to make sure that the child is not out on the street at all hours of the night. Okay? And that's something that, a caseworker and management can help you with, because then they might have to go to court to see if there is something that they can do. All right? All right, so this is something that you could discuss with your management team. All right, let's see. Next. Mental health and other. Status of your evaluations, if there is any. We have abuse, mental health, and substances. Okay, so it depends. Each category depends on what you're seeing and who your observations, what school is telling you, what relatives are telling you, parents, even maybe the next door neighbor, because you get to talk to neighbors too, in these cases. And then, if need be, if there is no evaluations being, they're not taking place, it looks like a recommendation is going in. Then you also want to talk to the child, because you don't know if there's some kind of a particular abuse going on that you want to find out about. And there you go. You might actually have to, like if you're in family services unit, you might have to call in a case, and then this is going to go to investigations. Okay. All right. So that's what that means. We want to see, and you want to actually check medical reports too, because you can have that discussion even with the physicians. All right. Okay. Let's go to the next slide. And there we are, the end. And I want to say thank you for viewing, and you have a great day. Until the next time. Okay. All right. Bye-bye.